Hello students, welcome back to yet another class of prosthodontics. So last class we have seen anatomic landmarks of maxilla and mandible. So today we will learn about posterior palatal seal. What is the importance of posterior palatal seal? So posterior palatal seal is a soft tissue along the junction of hard and soft palate on which pressure within the physiologic limit can be applied to aid in the retention of the denture. So, adequate PPS will resist horizontal and lateral forces acting on the denture, thus maintaining a proper seal. What are the function of PPS? It provides stability and retention to the denture. It prevents gag reflex for the patient, compressibility of the tissues, and it is comfortable for the patient. So, how does it add to stability and retention? PPS maintains contact with the soft palate during functional movements. What are the functional movements? Like mastication, deglutition and phonation. So by maintaining the contact, it maintains the retention and stability of the denture. Then coming to prevention of gag reflex. It reduces the gag reflex as there is no separation between the denture base and soft palate during normal functional movements. That it maintains the adaptation between the tissues and the denture. Compressibility. It reduces the food accumulation beneath the posterior aspect of the denture. So when you use the tissue compressibility properly, so there is a proper adaptation between the denture and the tissues. So it prevents the food accumulation beneath the denture. Comfort. The correctly placed PPS creates a partial vacuum beneath the denture, hence providing no irreversible alteration of the underlying mucosa. Due to this partial vacuum creation, there is no injury or harm caused to the underlying tissues. Now let us understand the structure of the posterior palatal seal, that is anatomic and physiologic structures. So it is basically divided into two separate boundaries. One is the post-palatal seal, that is it extends from one tuberosity to the other tuberosity, and the next is pterygomaxillary seal that extends with the entire width of the pterygomaxillary notch. This is your pterygomaxillary seal, right and left side, and the post-palatal seal that extends from one tuberosity to the other tuberosity this way. So now coming to a term called as vibrating line. What is vibrating line? It is the imaginary line across the posterior part of the palate that marks the division between movable and immovable tissues of the soft palate, which can be identified when the movable tissues are moving. That is, it is the demarcation between the movable and immovable tissues of the soft palate. It can be divided as anterior vibrating line and posterior vibrating line. So what is an anterior vibrating line? So it is an imaginary line lying at the junction between the immovable tissues of the hard palate. These are the immovable tissues of the hard palate and the slightly movable tissues of the soft palate. You can see the shape of the anterior vibrating line here. So this shows the demarcation between the non-movable tissues of the hard palate and slightly movable tissues of the soft palate. So how do you locate it? It can be located by asking the patient to say "ah" with short vigorous bursts. So how does this shape of the antevibrating line comes? It is due to the projection of the posterior nasal spine when the patient says "ah." So it's not a straight line, as we already saw. It is like a cupid bow shaped. The anterior part of the cupid bow marks the anterior vibrating line. Now coming to posterior vibrating line. It represents the demarcation between the part of the soft palate that has limited or shallow movement during function and the remainder of the soft palate that is markedly displaced during functional movement. That is, posterior vibrating line demarcates the this is the demarcation between the slightly movable tissues of the soft palate and majorly movable tissues of the soft palate during function. So how do you locate it? Instruct the patient to say "ah" in a short vigorous bursts in a normal unexaggerated fashion. The posterior vibrating line marks the most distal extent of the denture base. So now this is an important part. how do you classify the soft palate and what influence does this soft palate has on the retention or the stability of the denture or say PPS. So it can be classified as class 1, class 2 and class 3. Let's see what are these. So here class 1 indicates a soft palate that is horizontal as extended posteriorly with a minimum muscular activity. That is, basically this classification is given by looking at the angulation between the hard palate and the soft palate. So this angulation will tell you at what angle the soft palate is to the hard palate. So if it's a class 1, there is an it's a horizontal angulation. So with a minimum muscular activity, so you have a considerable separation between the anterior and posterior vibrating line. Thus you have a wider PPS. Thus it will contribute to better retention and stability. So class 1 soft palate has a good retention and stability. It's more favorable. So now coming to class 3. It is seen in conjugation with a high V-shaped palate. That is a high palate and a V-shaped palate. So here there is an acute angulation between the hard palate and the soft palate. So you can see here there is a more acute angulation between the hard palate and the soft palate. Okay, so this is very unfavorable because it provides a very small PPS, a narrow PPS. So there is less retention. So you can say class 3 situation of a soft palate where the palate shape is high and V-shaped has a less favorable for retention. Now coming to class 2. So this is somewhere between class 1 and class 2. So it provides a medium or say mediate retention. So how do you place PPS? So first step is ask the patient to rinse with the astringent mouthwash so that you remove all the stringy saliva. And then what you have to do is first you have 3 parts, that is pterygomaxillary seal, anterior vibrating line, posterior vibrating line. So once you mark all these 3, then if you join them you will get a posterior palatal seal area. So first step is to mark the pterygomaxillary seal. How do you do that? Take a T-burnisher, place it on the maxillary tuberosity and run it down until it drops into the pterygomaxillary notch. This is necessary as there are times when a small depression on the residual ridge may resemble like a pterygomaxillary notch and you might mistake it for that pterygomaxillary notch. So you need to run the T-burnisher from the tuberosity until you fall into a depression that mark the pterygomaxillary seal. So now you have marked pterygomaxillary seal. Now you need to mark posterior and anterior vibrating line. How do you mark posterior vibrating line? Ask the patient to say ah in a short burst in an exaggerated fashion and then mark the anterior vibrating line by asking the patient to say ah with short vigorous burst, or you can also use a Voltseva maneuver. So once you have marked all these 3, join them and you will get a posterior palatal seal. So once you have marked it in the patient's mouth, same thing can be transferred to your impression and the markings from the impression can be transferred to the cast. Okay, and then you can demarcate the PPS on your master cast. So now we understood what is a PPS, what are its function, how is the structure of the PPS, okay, and what are anterior and posterior vibrating lines, how do you mark it. So now let us understand what happens if you don't record the PPS properly. What are its consequences? So it can be, the denture can be like under extension of the PPS, over extension of the PPS, or under post stemming and over post stemming. So what will happen? Your PPS is under extended, definitely your denture will lose retention and stability. If it is overextended, then it will cause pain to the patient during swallowing. So usually he will complain of pain or unable to swallow properly. What is this under post stemming and over post stemming? This is something related to the depth of the PPS. If the depth of the PPS is short or it is less shallow, then you will not achieve a better retention. And if it is too deep, then it's going to harm or injure the underlying tissues. So now I would like to conclude the PPS topic by saying that it has a major role in development of stability, retention, prevention and compressibility and comfort of the complete denture. So this step of marking the PPS, recording the PPS in impression and transferring it to the Cast is a very important step. Thank you, students.